Hi, I'm Dr. Dipesh Navsaria, and I'm director of the MD-MPH Dual Degree Training Program here at the University of Wisconsin School of Medicine and Public Health. I don't do what most would consider traditional public health. I'm a primary care pediatrician, but I spend a lot of my time as medical director of Reach Out and Read Wisconsin. Reach Out and Read is an innovative program that aims to advise children and families that they should share books together from the youngest days of life, because of the huge implications this has for not just mental and cognitive health and school success, but also for the physical health of children. The idea is very simple. The prescription for reading is essentially what we do. We want families to understand that this is so important that they should treat it as seriously as any other prescription that we might give them or any piece of health advice, because again, of the huge implications it has not only for their health as a child, but for the whole life course through adulthood. When I came to Wisconsin in 2006, I was stunned to find that there was only one Reach Out and Read program here. There was about 30 or so in the state at the time. I got the attention of someone at the Capital Times, a local newspaper, as I started speaking more and more about the importance of early literacy in healthcare contexts. They did a story on the work I was doing, which helped garner some attention. We then applied for a campus grant, the Baldwin Wisconsin Idea Endowment, which we amazingly got, and it helped us do an important local proof of concept. We were able to start 4 Reach Out and Read programs in UW Health pediatric clinics, and to show that this could work in our local setting and make a difference in pediatrics locally. We also set up an innovative, one-of-a-kind inpatient reading library in the American Family Children's Hospital, serving kids all the way from the smallest of infants up through and including adolescents. We were able to open this with the assistance of then First Lady Jessica Doyle, who's a school teacher by training herself and has a great interest in literacy. This really showed that literacy could be incorporated into a variety of healthcare settings and make a difference, and both those arms of the program have been remarkably successful. We then went ahead and a few years later, with the assistance of the outgoing Doyle administration, set up Reach Out and Read Wisconsin. Karen Timberlake, the outgoing secretary of the Department of Health Services, helped work with the 2 children's hospitals in the state, and they co-funded Reach Out and Read Wisconsin. At that time, we had 55 clinics doing Reach Out and Read in primary care settings throughout Wisconsin. Now, less than 4 years later, we are at 97 clinics, serving tens of thousands of children, and showing families that the pleasure of looking at books together is actually very important and is important to their healthcare provider in terms of providing the best service possible. I'm fond of the saying from the Talmud, "It is not up to you to complete the task, nor are you free to ignore it." It's easy as a healthcare provider, in training or even when you're done with training, to look at the world of children and families around you and say, "This is too much. I can't possibly do anything about this." Children and families face poverty. They face homelessness. They face food insecurity. They face violence. There's so much, and you can feel helpless when your training is around the traditional world of healthcare. But if we do small programs or medium programs and we collectively put our effort into it, we can make a dent in these larger issues, because that's what our society needs and it's what our children deserve in order to build a strong, sturdy foundation for their future. And I hope that it's through examples like this and through great training programs like our dual degree MD-MPH program that we are training the next generation of people who will help make a difference in the lives of children, families, and the population of our state, our nation, and ultimately our world. Thank you.